Earlier this week, we told you about a Milwaukee County deputy who was administered Narcan after responding to a scene where he believed he was exposed to fentanyl.
And now the Milwaukee County supervisor is asking the sheriff for a toxicology report, stating that actual documentation of this would be the first ever confirmed case of a first responder experiencing fentanyl poisoning in the field.
Medical experts tell our Ben Jordan it's extremely rare for someone to overdose on unintentional fentanyl exposure.
It's a situation law enforcement agencies across the country have reported hundreds of times in recent years. An officer believed to have overdosed from fentanyl exposure, either through the air or having it touch their skin, while responding to an emergency call.
But what I would say is that it's almost like an urban myth that people are overdosing by just being next to it or touching money that has fentanyl.
Dr. Diana Botari leads Aurora Healthcare's opioid task force in Wisconsin.
The truth is that it would be very, very rare for that to happen.
Dr. Botari says that's because fentanyl needs to be ingested to get into the bloodstream in order to cause an overdose.
What happens to the body when you do overdose from fentanyl?
So what ends up happening is as the breathing slows down, the amount of oxygen that's in your body goes down too. And that means that we're starving the brain from the oxygen.
Dr. Ryan Marino is a toxicologist at Case Western University who studies opioid addiction and has made it his mission to dispel misconceptions about the secondhand dangers of fentanyl.
Fentanyl that we encounter in drugs on the street is a completely different physical form. It does not absorb through the skin really at all, and it cannot happen at all accidentally. It's also something that doesn't just get into the air, and so people can use fentanyl by snorting it, but you have to, again, very intentionally do so.
Dr. Marino says fentanyl is typically not a risk for anyone who encounters it casually, such as an officer responding to an overdose, but it's incredibly deadly for those who take the drug on purpose. How quickly can someone overdose from fentanyl?
An overdose can happen within seconds to minutes, and someone can definitely die within minutes. And so that's why situations like this, where having unnecessary fear, delaying the proper treatment or resuscitation, anything that is going to slow down a response time, is something that could really be the difference between life and death.
Dr. Botari says symptoms of an opioid overdose include being unconscious or unresponsive, breathing poorly or not breathing at all, and starting to look blue. She says people who find someone in that condition should immediately call 911, administer Narcan if they have it, and perform CPR.
Please go ahead and give them those life-saving breaths so they can live. If you touch something that you think might have had fentanyl on it or another drug that you don't know what it is, make sure you wash your hands. That is the most important thing.
Two doctors using International Overdose Awareness Day to decrease the stigma in hopes it can save lives. Reporting in Milwaukee, Ben Jordan, TMJ4 News.